Welcome back. Lou Graham at The New Norm, brought to you by Midway Dental and Catapult Education. We're back with Karson Carpenter, and of course we're talking OSHA infection control. In my last segment, we talked about the CDC and new guidelines. Well, what was interesting in Dr. Redfield's interview with NPR, he said after this first wave, up to 95% of the population will not have been exposed to the COVID virus. And his concern, of course, is what happens in the next wave, which would be in the fall. I'm not trying to scare everybody, but how we become more prepared. And that again leads into why these discussions with Dr. Carpenter and new guidelines really become so relevant. So welcome back, Karson. Let's continue on in our discussion. And I think you wanted to touch upon a few points about even how to just really change the waiting room that we're no longer using. So I'm going to turn it back over to you and let's go through some more discussion points, and then we'll get into disinfection. I'm going to hand it over to you.
Great, thanks, Lou. Well, one of the things that I wanted to mention is we talked about in our last session, really the waiting room really shouldn't be used as a waiting room during this COVID-19 pandemic, emergency, whatever you'd like to call it, in my opinion. Again, it should be the place that the patient passes through as they walk directly to the treatment room. That said, make sure that should somebody sit in your waiting room, make sure that staff disinfects that area that they sat in, armrest, counters they may have touched. Make sure to remove anything that doesn't need to be in there. Toys, magazines, all those things should be gone now. Our waiting room is going to look totally different here over the next several months. It's very important to me.
I agree with you. Okay, so let me ask you this, because sometimes you may have to sit a patient in that room. It's a chair, it's an environment. You talk disinfection. Everybody out there is talking disinfection. And I think in our first segment, you said a lot of offices have been kind of lax on their OSHA guidelines, yearly updates and things like that. And I'll tell you, I agree with you 100%, because we all get caught up in running our businesses. So let's talk disinfection now. As we talk disinfection, let's talk about what we're wiping our rooms down. Let's talk the waiting room. What would you be wiping down the waiting room? What specific protocol would you be doing? Let our attendees understand what those products are. Back to you on that. Please tell me.
Well, first of all, again, we've eliminated a lot of areas that they used to touch in the past because we've taken toys and games and different things out of there. The other thing is I would consider taking a number of chairs out of the waiting room, make it such that there's really only one. I mean, there should never be more than one person sitting in the waiting room. If they have people accompanying them, let them wait in the car. Okay, there's no reason for them to come in. Of course. So let's try to make it simple. Let's try to have only one chair that they sit in, one area that they sit in. In terms of what they disinfect it with, I'm good with any disinfectant that is on the EPA's what's called List N like Nancy. That particular list, those are disinfectants that are effective against human coronavirus. I will tell you that pretty much any good hard surface disinfectant that we're using right now, you'll find on that list. But do go to the EPA's website and look for List N.
So I'll make that a Midway task. The Midway team will go get those lists of items, and that way we'll be ensuring that their clients and clients listening to this broadcast can go and see those products. So those kind of products.
Let me mention one thing about that. Let me just mention that most disinfectants are on there, including a number of over-the-counter ones, because this is not a difficult virus to kill. It's an enveloped virus. But still, not only does it need to be on the list, they need to follow the instructions on that list. How long does it need to remain moist, for example?
Right, exactly. And honestly, I would rather use disinfectants that are not going to destroy my dental chairs and the plastics around them. So Some may be a little bit more prolonged, so to speak, and others not so. But we have found some disinfectants just destroy our plastic. So if it takes an extra 2 minutes, Karson, I'm not really bothered by that as long as you follow those directions. Would you agree with that?
Oh, I would agree. You want to follow the directions, but you also want to look carefully
Right.
on those instructions for use to see if it's safe for the
Right.
surface you want to put it on, because you're right. Our materials are expensive. We don't want to destroy them. There's plenty of good products out there that won't destroy them, but read the label.
Okay. Okay, so we've kind of covered the waiting room, which is now a one-chair waiting room if we use it at all. Fine. We've got the waiting room covered. We've got the disinfected waiting room. Now they're going to come into the operatory. Is there anything that you want to talk about in uniqueness of the disinfection as the OSHA expert of the operatory?
Well, again, like the waiting room where we said, let's only have one chair. In our dental office,
Right.
I don't think we need to be using multiple rooms. Let's pick one room that we really
Right.
want to use during this emergency situation. In our office, it happens to be room 7. We only work in room 7. Now, what you want to do in that room is
Right.
you want to remove any non-essential items, okay? No more loose
Right.
items. If
Right.
it's not wrapped, if it's not enclosed, it needs to be in a drawer or it needs to be in a cabinet. That's why I really like to preset the room. We basically know what we need to do an exam. Make sure everything is set up in there before that patient goes in there. Cover the keyboards with protective
Right.
barriers. Change those between patients. I never used full chair covers. I always used a headrest cover. I now use a full chair
Right.
cover. So those are the types of things we want to do. We want to have something that, first of all, very few things can be contaminated. Number 2, it's very easy to clean and disinfect that room at the end of the visit.
Yeah, that's a great point. Full chair covers, I've never used them. It's like sitting on my grandma's, plastic furniture, plastic covers. But in this, but in this case, as I'm thinking through it, if we're not protectively covering, let's just say we don't have enough surgical gowns, that is a great way of at least protecting transferring of maybe any kind of pathogens, and that's what Tracy discussed about from clothing to clothing or clothing to another human. So I love the idea of that. So everything should be kind of removed. Let me ask you another question. If you have the opportunity, if you have an office that has one enclosed room, I would think that would be the room you would want versus the open room. Tell me your thoughts on that.
Oh, you're exactly right, Lou. If you happen to have a room like that, that's the
Okay.
one you should utilize. In our office, we have 12 operatories. 11 of them are semi-open in design. We have one that what we consider our surgical suite, a closed-in room. That's where we treat the emergencies.
That's exactly our office. Now, I know some offices don't have that, but I still think even if they have open bay or an open system, I do think they should be consistently only working out of one operatory, as you said, and you would concur with that. Why get involved in all these other operatories? Yeah.
Exactly. And you know what? You can make
Go ahead.
that operatory bare bones. You can remove all those loose items we all used to have in an operatory. You can make that a very easy room to clean. Also, if all your operatories are semi-open, why not pick the end one where there's at least a wall on one side which will stop the flow of air somewhat?
Right. Great, agree. Okay, so now your assistant has set up your emergency patient. And the question now is again, openly, maybe on the questionnaire, you've asked the patient before they sit down what their emergency is. So for example, if it's a broken veneer, or let's just call that an emergency. I'm not sure it really is an emergency. But let's say they're coming in and their temporary bridge is out and it's on their front teeth and they want it re-cemented. I would have the operatory set up prior to them coming in with the best thought of what we would need versus going in and opening drawers and going through all that. So do you think a screening of the problem so that the assistant can set up the room would be a good idea so that we can minimize opening any drawers.
Yes, you want to have your staff ask very detailed questions. I mean, sometimes
Okay.
you can be fooled, but for the most part, we should know what they're coming in for. We should have those things set out, ready to go. It's going to make it a whole lot easier. But of course, remind staff, when we say preset a room, don't open that package of instruments
Right.
until that patient comes in there.
Right.
Of course, they're no longer sterile, but
Right.
have everything you think you're going to need there ready to go.
Right, and in a sense, you're really setting up kits so we don't cross-infect. So you really need almost preset kits. You know, if we're doing an extraction, which is an emergency, we have an extraction kit. But if we know, for example, we're doing a re-cement or whatever we're doing, I think if things are organized in kits, it will allow it to be a much more fluid turnover of the room and a much less chance of cross-infection. I think, would you agree with that?
Well, I agree. That's what we want to do. We want to think these things through before the patient comes in. And you know, one thing you did mention too, Lou, is truly they do need to be an emergency. We're going to have patients who want to come in for things that just aren't emergencies or urgencies, and our staff's going to need to know how to screen those and to talk to those patients.
Okay, so we've got the patient sitting there, and while you're talking to the patient, my feeling is, and you've already said this in the previous segment, that they should be wearing a traditional surgical mask just to minimize any contamination while you're just talking before you've done your exam. Again, agree?
Yes. Oh, yes, definitely.
Oh, okay. So as the dentist is there now in the room with the assistant, and we can all picture this, assistant's wearing her traditional mask. I'm wearing my traditional mask at this point. I just feel that's our coverage at this point. I'm wearing a head cover, she's wearing a head cover, we're wearing surgical gowns, we're covering our bodies up as much as possible, we're wearing booties when we're in that operatory. Am I missing anything prior to laying that patient back and doing the examination?
No, those are the things we need to have on. The exact things you're
Okay.
describing right there. Mm-hmm.
Okay, so now we're putting the patient. I know this is crazy, but I think every team needs to know this. So now we're reclining the patient. We're now going into the oral cavity, which is the most contagious of all. And I'm putting on my facial shield absolutely over my traditional mask at this point. And I'm going to ask you this. At this point, as I'm looking at the patient, do you feel I need a respirator mask, or can I still be using my traditional barrier masks? First question to you.
I will tell you that you've screened the patient, you've done all the right things.
Yep.
I'm very comfortable using what's called a level 2 or a level 3 mask at this point. I don't feel you need to use a respirator at this point. I really don't. And I think the CDC guidelines would concur.
I 100% agree with you on this, because I think people just immediately are thinking going to that, those N95s, KN95 masks. And again, I think if we're wearing them properly, and again, even wearing those masks properly, it's crazy. People not covering their noses. I mean, it's crazy, Karson, how people really don't even wear those masks correctly.
Oh, no, you're right, Lou. And let's face it, an N95 is not designed to be used all the time. First of all, if you've ever worn an N95 and tried to breathe through it, this isn't something that you can wear for 8 hours a day doing dentistry. This is something that you would select in specific cases to use.
I'm with you. And I think we're going to get into the N95 or KN95 mask in our next segment, because at this point, I'd love to end this segment because we've now gone through 2 segments of screening, meeting the patient, getting the patient really prepped for walking into our office, the turnover, the disinfection of our operatories, and now we've had some interaction with our patient before we get into any clinical procedures. I want to thank you, Karson, for being on the new norm, and we're going to get into masks and far more in our next segment. Thanks for being with us. And Karson, stay tuned. We're going to get moving to our third segment.
That sounds great, Lou. Thanks again. I'll talk to you at the next interview.
Great. So let me be clear. We want to hear from you. We want to hear your questions. So what we want you to do is we want you to go to education@midwaydental.com. Shoot us your questions. We'll go right to the experts. I know I'm not the expert, so let's go ask the experts what we should be doing as our next step next week, the week after, and thereafter. I look forward to hearing from you.